Good afternoon, everyone, and welcome to our next panel exploring the intersection of technology-enabled solutions in health and overall health and financial health. My name is Matt Bahl, and I'm the Vice President and Market Lead for Workplace Financial Health here at the Financial Health Network. And I'll be moderating this panel of our esteemed guests. We're going to dive deeper into a lot of the conversations we've heard today, principally exploring ways that technology and tech-enabled solutions and innovation can further connect, impact, and solve for the financial health challenges as they overlap and intersect with overall health and well-being. As we get started, I'd like to ask each of the panelists to provide a brief introduction to highlighting their professional background and in a sentence or two, highlighting why they're passionate about tech-enabled solutions and why they believe it's important to connect health and financial health together. I'd like to start with Tom Spann.
Thanks, Matt. I'm Tom Spann. I'm the Chief Executive Officer of Brightside. We're the first financial care platform for employers, and we think about financial care, and this sort of gets to why I'm passionate about this, is different from financial wellness like healthcare is from physical and mental wellness. It's good to have financial wellness, but when you look at a country where only 29% is financially healthy, then you've got a lot of financially sick families, and they need more than just coaching, they need real solutions. So with employers paying us, we're able to not only help their employees navigate the complex world of financial services, but we can offer unique paycheck-linked products that employees can't get on their own. And while we're not a bank, we can be the financial home, much like the medical home concept in healthcare. And since we're not making money from fees and interest, we can do things banks don't do, like lower your interest rate when your credit score goes up. And I sort of got passionate about helping working families when I was the founding CEO of Accolade. So I did that role for 9 years before hiring a new CEO. And that was a company that helped employees and their families navigate a different complex system, the healthcare system. So it's probably why I'm bringing some of that healthcare language into financial health. And and Brightside was the idea of one of Accolade's customers who said, something like Accolade is needed in the financial health world.
Great, thank you, Tom. Harsha?
Yeah, thanks, Matt. My name is Harsha Puvvada. I'm the co-founder and COO at MedPut. And for me, I actually grew up in India. My parents are doctors. They ran a hospital. Probably a little disappointed that I'm not a doctor, but it's a much longer conversation. But I've always been around healthcare. And in developing countries, you see quite often that wealth and health are clearly correlated. And when I moved to the US, I realized it's the same here as well. People who are well off get better treatment. And I really feel like technology is a great equalizer. And I'm excited to use the opportunity to use technology to actually scale solutions that reach people that have been historically underserved through financial products. And that's really the reason we started MedPut. MedPut is an employee benefit that provides interest-free financing and bill discounts for any out-of-pocket health expenses for employees. So we sell to employers. Employers offer MedPut as an employee benefit. And whenever there's a bill, the employee just needs to take a photo of that bill, submit it to us, and they're done. So we negotiate that bill, we pay the hospital or the doctor directly, and then we get repaid through small interest-free payroll deductions. So it's basically a way to prevent people from putting bills on a credit card or from taking a payday loan or a 401k loan when they can't afford to pay for their healthcare bills.
Thanks, Harsha. April?
Hi, thank you. My name is April Gill. I'm the Senior Vice President of Solution Management at Welltok. I will just start with my passion first. I've spent over 20 years in healthcare, really focused on organizations that are, technology enabled, primarily high growth. I've worked with all stakeholders, health plans, providers, employers, and everyone is trying to solve similar problems, but from a different perspective. And so my passion is really about bringing technology to bear to improve overall health and well-being. And that's really what Welltok is all about as well. So, we are pioneers in the world of consumer activation, and for us, that really means getting people to do the things that help them manage and improve their health over time, which encompasses financial health and well-being, in addition to many other aspects of what you traditionally think of in healthcare as ways to be healthy or manage your health.
Great. And Tom Cassels.
Sure. Hey, everyone. Tom Cassels. I'm the president of Rock Health. Really excited to join the conversation today. Rock Health, for those who don't know, is an interesting two-sided business. We are, since 2012, we were the first seed stage and early stage VC fund to focus solely on digital health solutions. We've continued that focus. We now have a second side of the business where we advise and work with quote unquote the buy side of healthcare, which are the large biopharma, health tech, hospital and health systems, health plans, to really reach a goal of accelerating the adoption of technology-enabled services and digital therapeutics. My passion for this conversation is a woman named Monique. Monique is my mother's social worker, and in reality, my social worker, as my mom has early onset dementia. We are working with 3 children across 3 states to really address the challenge that is not just the actual disease, but the complexity of dealing with the financial aspects, the health aspects, the social aspects. And so I don't think you can talk about healthcare without talking about finances these days. That makes me passionate about being here with you today. Looking forward to it.
Well, thank you for sharing that, Tom. And I want to turn over to Tom Spann first. Tom, there's been lots of discussion and some research relative to the impact that financial stress can have on overall health. I'm wondering if you wouldn't mind sharing your perspective on how you're seeing financial stress impact overall health, and how do you think tech-enabled solutions can better target financial stress and then measure the impact it would have on health outcomes?
Yeah. So, a lot of this has been discussed in some of the other sessions today. Financial stress is a big part of it, right? It's obviously a result of poor financial health, and the evidence that stress makes you sick is overwhelming. And and the financial stress may not even be something somebody self-reports as the primary stress. 48% of all relationships have fights over money every year, and that's the biggest predictor of divorce, according to the Family Relationship Journal. 65% of Americans lose sleep over their finances every year. That's in good years. Like, this data is all pre-COVID data. 75 to 90% of all doctor visits are stress related. And 7 of the top 10 medicines in the United States are for stress related disorders, depression, anxiety, ulcers. There's a lot of focus on that part as people talked about the economic impact of COVID. The increase in anxiety, depression, suicides, but I think that's only a piece of the story. So it started to come out earlier. What I saw at Accolade was by far finances were the biggest barrier to getting good care when you needed it. And what I think Accolade proved out, and a lot of other businesses in that space are now proving, is, the healthcare industry grew up trying to make it hard for you to make mistakes in healthcare, but it made it hard to do anything in healthcare, usually with financial things, things like high deductible health plans. But the reality is getting that right care sooner is better. And there's been a lot of great work by Saul Wiener, University of Chicago. He studied both doctors and hospitals and Accolade, and 65 to 75% of everybody who presents has some sort of life context barrier. A lot of people call it social determinants of health, but even busy executives could have time constraints. There's other things that aren't biomedical. But 70% of the time, that barrier is financial in this country for working Americans. And the cost of not addressing it is 10 times that of making a biomedical error. Right? A doctor who makes a medical mistake, that costs on average $30 a visit across all the visits in the United States. Missing the person who can't afford their meds and prescribing a more expensive med when they weren't taking the one they had costs $231 for every visit in this country. It's a huge driver of waste. 44% of Americans skipped a doctor appointment in 2017. 40% skipped a recommended procedure. And so you can start to see why, you add the community factors into that, right? The people live and they don't have the support in their community to be healthy that was talked about in the great opening session. 4.5% of all deaths in this country every year are from financial health, right? They're from poverty and people not having the money. There's a great book by Richard Cooper on poverty and the myths of healthcare reform, where he sort of says a lot of the work of the early part of the century was misdirected in terms of tackling the system. If you actually could tackle the economic disparities, that would take 30% of the costs out of this healthcare system. So you can see the tie between obviously income and financial health, but it's also income and physical health, but it's also income and financial health. So, what we've done at Brightside is use technology to build rules engines for a financial system. So we build a business where we think, given this complexity, all those contextual barriers, social determinants of health are also social determinants of financial health, right? There's a lot of things that get in the way when your mom steals your car, so you lose your Uber Eats second job, was paying for your kid's daycare. Now you're staying up all night because you can't afford daycare, and obviously not a particularly productive worker when you go to work in the day. Or somebody, a family member put their utility bills in your name, didn't pay them, now your credit score is going. That kind of, those kinds of things you've got to address. You can't just hand somebody an app and say, here, this should fix your finances. So we've used technology to be behind those financial assistants, those people, so everybody gets their own coach, their own financial assistant. We use technology to help collaboration in our mobile app between the financial assistant and the employee or their family member. And we use the technology to monitor ongoing financial health. So that's kind of how we're thinking about it.
Yeah, that's great, Tom. It's like almost how do you help provide the support and apparatus that help people manage just the day-to-day living activities, given their unique context and circumstances, and then using technology to understand people's lives and then deliver solutions that meet them where they are in ways that extend even beyond the workplace, but into their communities.
Exactly.
I want to turn to you next. And, thinking about the work that MedPut does, but also just your personal background. I'm sure your parents are proud of you despite not being in a physician, and there's still time. You could do both. There are plenty of folks who are innovators and physicians. But I'm wondering if you could maybe talk about what are some of the financial pain points that you think are most commonly experienced as people encounter our medical system? And what are ways that technology can help solve for that? And I'm thinking particularly on the comment from an earlier panel about people delaying getting treatment because of high costs. How do you think about that? And how are some of the additional pain points manifesting?
Yeah, absolutely. I think there's a few key pain points, right? The first, and this is something that's been in the news a lot, is transparency and pricing. Healthcare is basically the only industry where a consumer purchases a service and they have no idea what the service is going to cost, right? So you're consuming something, but you have no idea what it's going to cost. And on top of that, you don't know if the charges are accurate. So even if you had an idea or an estimate of the cost, you have no basis for knowing whether the price is accurate or not. And there's a pretty decent chance that there are mistakes, right? And then there are exciting technology solutions that are kind of addressing both of these issues, So there's a lot of startups that are working on identifying high quality, low cost providers. I know Walmart also has some centers where they disclose prices transparently upfront, and people know there's a fixed price. So there's a lot of work being done there. There's also tech companies that use AI to go through your bills and be able to identify if there's a likelihood that there may be some mispricing involved in there. So those are two of the big issues. And even if we were to solve for both of these challenges, the fact remains that healthcare is still way too expensive. So even if we were to help bring transparency and reduce the errors, if you look at the way healthcare costs have inflated relative to savings rate and wage growth, it's a no contest, right? So over the last decade, deductibles have inflated at probably 5 or 6 times average savings and wage growth. So that delta is going to exist. And I think there have to be solutions that are impacting people's ability to pay. So a lot of revenue cycle management solutions affect individuals' willingness to pay. But in addition to that, there have to be low-cost financial or payment plan type solutions that actually allow people to make payment. And I think this problem is actually going to be exacerbated in the future because as more and more services are being shifted to ambulatory care centers instead of hospitals, because the co-insurance charges at these facilities is bone crushing, no pun intended. And so a couple of years ago, I had an ACL surgery from a soccer accident, and it was like a 25-minute procedure, and the bill before being discounted by insurance was $115,000 for a 25-minute procedure. So even if that is discounted, just imagining co-insurance on top of that would make it extremely difficult for the average American to pay for it. And I just wanted to add one other thing, and that's to realize that in addition to individuals feeling the pain, there are multiple stakeholders, all of whom are impacted by the situation. So just take the example of a person who goes into the hospital, comes back with a $2,000 bill. He uses his credit card to make a part payment and is not able to make future payments, right? And is then sent to collections. So if we just take a step back and look at all the stakeholders that are affected, first is the individual himself or herself. That person's paid credit card interest. Their credit score is going to be affected if they don't pay in time, and they're under a tremendous amount of financial stress, like Tom just mentioned. Now, if you look at the employer, because that employee is under financial stress, that employee is not as productive at work. They're going to hesitate to go in and get treatment the next time they have an out-of-pocket expense. So that's going to increase the percentage of emergency visits, reduce the percentage of primary care visits, which will shift the cost curve upward. And that person's a higher termination risk because they're looking for other places where they can have better health coverage. The provider is affected because now they've performed a service for which they've not been compensated, and that relationship with the patient is damaged. And even in the insurance company is affected because now people are going to delay treatment. It's going to make the population health on average worse off. And when it comes to negotiating payments with hospitals are going to say, hey, you guys have been pushing out these high deductible plans. We haven't been able to get paid, so we're going to have you charge you higher, and so it turns into a vicious cycle. So this is an issue that affects every stakeholder in the system.
Yeah, and I think the point about you receiving a $115,000 bill also speaks to some of the changing ways that care is being transformed, right? As we see more push towards outpatient versus inpatient and the shifting cost structures, which no matter how transparent the system is, those cost structures are driven so much by the payment side of the house. And so I think those are also important things to think about, is the complexity of the system and how technology can potentially solve for some of the cost barriers, but there's still the care barriers and other barriers that are impacted through that. Very interesting. And because of the level of your jokes, you could also be a stand-up comedian. So your career is bright, Harsha. You have infinite possibilities. April, I want to turn to you. And we heard from the employer perspective panel earlier about the role that employers are playing. And one of the challenges I think employers face is this field of dreams fallacy, which is just because they build a financial health program or they have a healthcare program does not mean employees will come and use it. And so given the work that Welltok does in your own background, how should we be thinking about engagement? And how should employers be thinking about ways to leverage technology to better engage their workforce in the right solutions at the right time?
Yeah, it's a great question. I think, you know, I won't be as bold as to say you shouldn't think about engagement, but what I will tell you is everyone defines engagement differently. And at Welltok, we really think about activation, which means people doing things that move the needle towards improving their health, whether it's financial health or truly managing a condition, or just remaining healthy so that they don't have rising risk. And that activation is really driven by understanding who the population is. So taking lots and lots of data and information, you know, we talked a little bit about social determinants of health. That's definitely a factor. To really get a 360-degree view of a population is sort of the backbone of how you start to then affect both engagement and activation, because you need to understand who needs what or who has specific risks. And then also, what are their behaviors? Are they actually ready to change? Are they ready to engage in a particular program? Will they finish it? And will they have a desired result? And those are all of the things that our analytics identify. A tech-enabled, you know, program to help people manage their health, regardless of what the category happens to be. To your point, that if you build it, that doesn't mean that they'll come. So having a program that has a coach associated with it, or a program that's self-directed, those are really key components of serving the totality of what a population may need. And being able to identify who's going to be most receptive to and likely to be impacted by that program with a coach behind it, because they need more hand-holding, versus those that will do a self-directed program and have a desired effect, allows you to use resources more efficiently, so that you can really align the more high-touch approach for those that need it, and a more high-tech approach for those that are tech-savvy and can go through that on their own. So I think, you know, understanding engagement is important. Obviously, if people don't engage, then they're not going to do anything. But it's really understanding who got their flu shot, who went to see their physician, who went through a training program around financial health and actually opened the right account for them based on their stage of life and what their financial goals are. Those are the kinds of things that I think are the most important to measure.
Yeah, that's really impactful.
And I'd also add that the employers have a lot of say in their employees' journey, right? One of the things that worked at Accolade was just, for example, being the number on the back of the insurance card, which created, you know, huge engagement opportunities, because people were about to use the healthcare system almost every time they called that, and usually with some sort of financial issue, right? Is this covered? Is, you know, that kind of thing. And in Brightside, we're seeing the same thing, right? When you start a new job, that's a moment that matters. When you go on disability, you lose a third of your income. That's a moment. You know, you ought to be getting financial care in those moments. The employers can certainly at least make it a strong default in these journeys before people do things like take out a hardship withdrawal on 401k.
Yeah, that's a
Yeah,
great.
I totally. Oh, sorry. Go ahead.
I was just going to compliment Tom, so please, you go.
I was just going to say, I wholeheartedly agree with that. And I think it's really crucial for employers to remember how humans work, right? The human brain only has so much capacity to manage stress and crisis. And in the current environment, we pretty much have hit our maximum. There are benefits that all employers offer, that many health plans offer as sort of a throw-in value add, like EAP, that provide financial counseling, access to a mental health counselor, legal advice, all of those kinds of things. The average utilization rate for an EAP program in the United States is 1% to 2%. Why? Because you only ever need it once in a great while. And when you're in a crisis, your brain actually can't think the same way that it does when you're not. So you can't even remember what you have access to when you're trying to manage through that particular issue. You need to have the ability to drive that into the face of the person who needs it when it's relevant for them. That's the best way to really get them to be aware and utilize the things that you've invested in as an employer.
That's really great, April. And I think you should be bold and say engagement is not the goal, but activation is. So I think that's a really important distinction that would help a lot of organizations think differently about how they deploy solutions to their constituencies. I want to go to Tom Cassels. And Tom, you raised a really important reality for so many folks in your opening statements around caregiving and the really interesting intersections of health and financial health as it relates to caregiving. I'm wondering if you could maybe expand a little bit on how you're seeing financial and overall health impacts on the caregiving environment, and what new innovations are you seeing that are seeking to address and remediate some of those challenges?
Sure. It's every day as a VC, I talk about total addressable markets. One of the things that a lot of people don't know is that caregivers in the United States are one of the largest total addressable markets out there. So right now, 1 in 5 Americans is a caregiver giving unpaid care to a loved one, a neighbor, what have you. This is almost evenly distributed across generations. So this is not a Gen X taking care of an aging boomer population. I think actually 37% of these caregivers are either millennials or Gen Z. A large part of that is because they're a caregiver to not just grandparents, and people think of this as a kind of the gray wave. Actually, it's both the aging of our country and the incidence rate of developmental disorders for children in our country. I think it is shocking that 60% of all of these caregivers are working. These are your employees. These are my employees. And 61% are women. So, we're going to talk about equity a little later, and I have a lot to say about that. The health impacts for caregiving are pretty stark. And I think Tom mentioned it earlier, and I think perhaps everybody hit on this, but 20% of all of the caregivers in America report a health decline from year to year when they are actively caregiving. And that presents in terms of high blood pressure, that presents in terms of depressive disorder, substance use disorders, mood disorders, all of which, by the way, we have a massive supply-demand gap for. The financial impacts are really shocking. 45% of all caregivers have had at least one material financial impact in a given year. And that ranges from paying a very expensive bill to asset management decisions that you have very little knowledge of how to make with respect to, especially for long-term care, access to Medicaid services. The one that personally gets my goat the most is that we like to talk about we want people to be able to age in place. Aging in place is a luxury good in this country, and it's a luxury that almost no one can afford. And it's all out of pocket. So that kind of reality, I'm actually optimistic because of the companies that I'm seeing who are running at this space, and running at the space as what I would call, and Tom would know probably more than I, kind of navigation technology enabled services. And they come in two flavors. One is actually caring for caregivers. So a couple of companies that are doing some really excellent work here, Care Tribe and T-Care, really kind of putting together services for the caregivers themselves to keep them healthy so that they can keep their loved ones healthy. The other flavor is care coordination. So especially for frail elderly or pediatric developmentally disabled or physically disabled children, you don't have a doctor. You have 5 doctors and 4 therapists, and they don't talk to each other. So, you know, the organizations that I see like Unite Us, MadPow, Atlas of Caregiving, these are folks who are really looking to tie those pieces together so that you can have actually a power derived from that large, currently fragmented team by really bringing the team together around your goals. So as rough as those numbers are, I am optimistic that we're seeing people invest behind them.
That's great, Tom. And go ahead, April.
I was just going to say, if I could just add to that, you know, that the issue of aging in place, it really is hitting everyone, right? So there, in a recent survey that AARP conducted, 57% of Americans want to age in place, but there are only 10% of them that can afford to do so. And when you're like me, I am actually in a sandwich. I have kids in college, kids at home, and I have an elderly parent that I care for who lives with us. She was in an untenable situation, living in poverty, living in a place that was not safe. We had to literally pluck her out of a different state and move her, which meant a whole host of issues that we hadn't anticipated. You know, when you think about parents in retirement or when you think about caring for a loved one, typically you plan, and we did. But what I didn't know was what it was going to take to find the team of doctors, what it was going to take to make sure medications got transferred, I mean, there's this whole list of things, not to mention the isolation associated with getting plucked out of a place that you've lived your whole life and moved to another state with no support system except for us. So I just wanted to, A, share a personal anecdote, but B, really underscore the importance of understanding the situation that employees are in and the kind of burden that they've taken on out of sheer necessity. And it's not about enough planning, right? These things are unexpected. It can absolutely take a toll on overall health when those kinds of things pop up, because they feel insurmountable at the time.
Yeah, so very true. And I think, you know, some of the numbers that Tom Cassels provided around just the number of individuals who are even unbeknownst to themselves in caregiving roles, I think is really staggering, and certainly speaks to the need for innovation and thinking creatively about solving those systems. We did get a number of questions from the audience, so I want to try to address some of these before we wind down the session with the equity question that I think is important for us to get to. So I want to raise this question, maybe direct it first at Harsha, and then others can chime in. Harsha, we had a question around tech companies' ability to, in light of HIPAA, to unify someone's health data in one place to allow them to make better decisions around which provider they would go to, as opposed to being locked into a single provider. So speaks somewhat to the transparency issue. So maybe have you, Harsha, speak, and then April or others who have any thoughts can add to it.
Yeah, absolutely. So I think there's a company called Healthcare Blue Book. There's a few others that allow you to see, based on a given service, what the top quartile or the top percentile providers charge, what the lowest quartile or percentile charge, what the average cost should be. And then also on top of that, there is the quality weighting of these prices. So I think there's a lot of startups that are looking to actually compare pricing by location and then layering the quality on top of that so that people can make an informed decision. And your health plan and your network information is often fed into that. So it's pretty clear what your out-of-pocket cost is going to be. And there's also a lot of insurance brokers, especially for self-insured companies, who have a list of preferred providers where there's often no out-of-pocket cost. And that's a way to reduce costs, not only for the employees, but for the employers as well.
Great. We had a related question, but I want to get to another one before we circle back. And I'm going to direct this one to Tom Cassels to start with, but how do you think about, from a VC perspective, sort of the need to address the symptoms of the broken healthcare system versus the root causes of the healthcare system? And so how do you think about where innovation plays a role? Is it playing a role in solving root causes, or is it playing more of a role in sort of plugging the outpour from the symptoms?
It's hard not to be blunt about this question.
That's why I asked you, Tom. I figured I'd get a blunt answer.
Innovation that's necessary is investing behind people of color and women. It's kind of hard to help caregivers who are disproportionately in those categories unless the folks who really know the problems that they're facing are the folks that are building technologies and new business models to actually make healthcare not just available. You can make an argument that every ED is available. It's not accessible if you're going to be treated like a second-class citizen because of your race. It's not really accessible if you can't afford $50. So my optimism is that more people, my fund included, are going to invest behind the folks who are best suited to actually understand the jobs to do that these folks have, and build services that, frankly, I think a lot of the people that I've invested in, they work with the Medicaid community, but it wasn't by design, and that's the innovation we need.
Great. We've got about 3 minutes left, and I want to make sure we get to a really important topic and question, and that's around this equity piece. And I want to start with you, Tom Spann. I'd ask you to use the time to answer this question, then also provide any closing thoughts you may have. But as we continue to see the impact of COVID, as well as all of the recent events happening across the country, focusing on systemic racism, the impact and disproportionate impact of outcomes on people and community of colors, what role do you think that both employers and tech companies and innovators play in helping to address and remediate some of those challenges? It's a big question, but you only have like 30 seconds apiece.
I probably build on Tom's answer to the last question as well. If in fact there's, 30% of healthcare costs are driven by this accessibility problem, of which finances is the biggest barrier, right? These issues, you can separately work on addressing racism in the provider community, but I think people serving these communities, the doctors and nurses, are trying to do the best job they can. That's not the problem. The problem is people don't have the financial resources to access the healthcare system productively, and so they don't get the care they need, and then they go and tackle it a different way. And so, if you think about that notion of financial health driving healthcare costs and the problems in our healthcare system, then you lay on that the fact that employers are paying for those healthcare costs, and they want inclusive and diverse workforces, right? An inclusive and diverse workforce. I've heard the phrase, if you're a woman or a person of color, you have to work 3 times as hard just to stay even. Well, think about the facts we just said about financial stress. If I'm going to miss 20 more work days a year because of financial stress, if I'm going to lose 13 IQ points at work because of financial stress, if I'm going to be sicker and less healthy and not getting the healthcare I need because of financial stress, And how am I supposed to perform as well at work, right? I think if you're an employer, you got to say, I got to tackle this issue of the financial health of my employees, and it will disproportionately, it will, in a good way, affect women and people of color differently because their financial situation, as the first session that I outlined, is just outrageously different.
Thank you. We have time for one more panelist to share thoughts. So April, I want to give you the final word before we close out.
Thank you. I appreciate that. Yeah, so I think that this question of equity, unfortunately, what's going on in the world is affecting people of color and women at tremendously higher rates than others. I think that it's imperative that we all take some responsibility for ensuring that our organizations are clear about what they will and will not tolerate, first of all. And I think we have to go as far as being anti-racist, not just following the rules, which allows the system to continue. Secondarily to that, though, and as importantly, we have to offer support and programming that will address the caregiving stress, that will help address the financial stress, that also promotes for the individuals that are the employee the kinds of support programs that they need in order to get them through what is probably the most difficult time we're going to have, certainly in this decade, if not significantly longer than that. And so it's super important to make sure that you've shored up your benefits offerings, people know what they have access to, and to the extent that you do have to make difficult decisions about your workforce, make sure that you're communicating about what's available to them in the community.
Well, like at the award shows, we're getting the playoff music. So we thank everybody for paying attention. Thank you to our panelists for providing such tremendous insight. Thank you all for your leadership. And thank you all in the audience for joining this journey with us.
Thanks, Matt.
Thank you very much.